The Department of Health in Gauteng says it is concerned about the rising incidence of foodborne illnesses, particularly those affecting children. This after the death of a 10-year-old girl who died on Saturday night after complaining of chest and stomach pains. Motalatale Modiba from the Gauteng Health Department, he is the spokesperson. He now joins us for more on this conversation. Motalatale, thank you so much for your time, sir, this evening here on SABC News. Let's begin here first. We saw what took place today in Alexandra. As the Health Department, how do you react to the latest death of yet another child?
It's something that is rather concerning. That we have so many incidences where we are losing young lives, and it's something that obviously concerns us. And I think you've already seen at the level of the national government, there's some of the steps that are being taken in terms of to address this issue, but to coordinate efforts aimed at ensuring that we educate society, but also that action is taken insofar as clamping down on establishments that do not comply with the laws of the land, while at the same time we taking efforts to educate the public, given that there is a greater need to heighten the awareness and the education.
And Mr. Modiba, just looking at the visuals coming out from Alexandra today, it seems as if the community of Alexandra is yet again blaming spaza shops for the latest death of a child. What do we know so far? I know it's still a bit early, but what do preliminary investigations tell you?
No, what we know is that the 3 people presented at the Alexandra CHC. First, it was a child, 10-year-old child, who was brought in. Unfortunately, the child demised at the time when they were bringing them to the facility, and then a mother complained of having stomach cramps and not feeling so well, and she was rushed together with another 4-year-old child to Edenvale Hospital, where they received medical attention. Earlier today, when we spoke to the doctors, they said no, they are stable, they are doing fairly well. So we suspect that this could be a foodborne illness. At the moment, obviously, until the test results come out, we're not so clear as to exactly what it is, except that from the reports that we're getting, that they would have eaten something, they would have ingested something. So that's the sense that we're getting at this point in time. But I think it's important that we also appeal to communities not to take the law into their own hands, to allow the relevant authorities to properly investigate this particular matter, so that we know. We've seen now in the recent incidents, even when the Nut Joints gave a briefing last week, where they explained to say in some of the recent incidents, like the situation in Naledi, they were able to trace chemical agents being organophosphate in that particular incident as being the cause. So we don't want people to jump into conclusion. So we want to plead that they would allow the processes to unfold. What we would rather do is to educate the public in terms of what they would need to do. Things like when they go and buy their food items, to make sure that they buy from reputable sellers, people that have got permits to operate. We make sure that people do check expiry dates. We ensure that they don't buy food items where they cannot see the label or the packaging is damaged. But also, we're making a call as well to shops and other operators within the communities to ensure that they operate within the ambit of the law, to ensure that they comply with environmental health regulations that are there, and then also that they maintain hygiene standards. But you're quite right. I think earlier on you did indicate that we should not also scapegoat and simply just point at spaza shops without necessarily also looking at other factors within our environment, and also what is it that we are doing as communities. Because remember that even ourselves as communities, we have a role to play in ensuring that we are safe, in ensuring that we report some of these things to the relevant authorities.
And earlier on, Mr. Modiba, I mean, you were talking about that communities should not take matters into their own hands. And, you know, looking at what took place in Alexandra today, we saw some of the community members alongside the police when they tried to invade that spaza shop and forcibly forced themselves inside that spaza shop and wanted those goods to be seized. We now know that police have seized those goods. How long will the investigations into, you know, the sale of the goods inside that shop take?
That is something the police would be in a better space to perhaps respond to, because now it's a police matter. The police are obviously investigating, but I think it's important that we reiterate the call to communities to say, when the public takes matters into their own hands, what happens is that they then interfere with the evidence, they interfere with the investigations that the police or any other authority that is competent to investigate might want to do. Hence, we always say, rather, where they suspect that a particular establishment might not be complying with the regulations and the laws, they must rather engage and call the authorities so that the relevant competent people are able to handle that, they are able to collect whatever evidence that they need to collect. But what is quite clear from this whole situation is that we need to do more. We need to do more to educate the public, both those that are selling within communities and those that are consuming those products, in terms of the usage of pesticides, insecticides, because we are also picking up that there is a wrong usage of pesticides, or even the wrong pesticides that are sometimes being utilized, as you would have already seen when the briefing happened last week, where in some places they had organophosphate, which is not supposed to be in domestic settings. So I think from a public awareness point of view, we need to do more to educate the public so that we don't find ourselves vulnerable to this kind of incidents that are currently taking place.
And Motalatale, of course, we know that, you know, organophosphate, which is something that you keep on referring to, that was found to be, you know, at play there when it comes to the Naledi children who passed away a couple of weeks ago. And when it comes to, you know, the ongoing trend that we see, I mean, this has never been seen before, that week in, week out, it's either we see children being hospitalized or children dying. How worrisome is this to you as a health department in Gauteng?
I think it's a concern, not just the health department, because remember, this whole matter is not a health matter. It's a societal matter, given that it affects, it's got wide implications. It's just that obviously as health, we feel the impact more because people that end up being affected by either it be chemical poisoning or food poisoning, they end up in our facilities where we have to then provide medical care to them. But it's not just a health issue. I think it's a societal issue, because there's quite a number of things. There are socioeconomic factors that are at play that we need to look at, and hence the response to this requires an all-of-society response that requires multiple stakeholders. There's a role that municipalities would need to play through the environmental health practitioners in terms of ensuring that we implement the laws, we're able to find, we're able to close establishments that don't comply. But there's also a consumer element that, as consumers, we have rights as well, insofar as where we buy our goods and all of those things, because it can be that as communities, we continue buying goods in places where we can see that our lives are being affected. But there's also another element from a point of view of educating the public, as I've already indicated, in terms of in our own environment, the environmental issues, such as keeping our environment clean, to ensure that we don't have a huge problem of rodents, because in some instances what we're picking up is that people are trying to use stronger agents or chemicals to fight this problem of rodents infestation in our communities. But at the heart of that is things like your illegal dumping, is things like when we don't dispose of refuse in the correct way, it ends up then obviously creating this other challenge that we're having. So it will require that all of us will work together so that we don't just say it's just a spaza shop problem. It might even not be necessarily a spaza shop problem. It might be another problem that requires all of us to get involved in. And hence, there's an effort now to mobilize
All right.
all of society and then various groupings to play a role in terms of ensuring that we clamp down on this particular incident.
Motalatale, thank you so much for your time this evening and for giving us that information when it comes to yet another death in Alexandra now. Of course, this at the hands of what is said to be suspected contaminated snacks bought from a spaza shop. That is Motalatale Modiba. He is the Gauteng Health Department spokesperson.